What warnings were you given about prednisone? And did they come true? Hi, I'm Dr. Megan, your prednisone pharmacist, and I have asked this question to thousands of prednisone warriors. What warnings were you given and did they come true? So I'm going to go through some of the comments that they've shared to decipher, did they get any warnings? And if so, were they the right warnings? First of all, let's talk about what are prednisone warnings. Prednisone warnings are what you should have been told when you were prescribed prednisone, right? You should have been warned about the side effects. You should have been warned when to take it or how to take it. All of these warnings are what you should have been told. And if you weren't given them, because that was the actual number one response was none. None, 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 none. Nobody was given the warnings about prednisone, any warning. And that really makes me sad to hear as a pharmacist and healthcare professional, because that means my pharmacist colleagues and the discharge nurse and the doctor prescribing it, none of those people warned anybody, or they don't remember being warned. That's a possibility too. So what should you be warned about? Well, I'm going to read a few of the comments people made on my Facebook posts about this, and they will give you the warnings that they wish they'd known. All right. And this first comment really gives you the exact tone I want to help you understand. This person said, none. I had no idea of the ramifications of this med. I only learned after years of taking low doses that my bones are crumbling. Too late. She thought it was too late now. She wished she'd known earlier. And I don't want you to have that too late now regret. Let's find out what these prednisone warnings are so that you don't have to deal with that kind of regret. You can know that you're a prednisone warrior. You're doing everything you can to prevent side effects and the fulfillment of these warnings. Other people have said, my doctor tried to tell me the only side effect was insomnia. And that's completely not true. Prednisone actually has at least 150 side effects possible. I compiled all of the different lists of prednisone side effects into a searchable list. You can look it up to find out whether what you're experiencing is a side effect or not, and that can really help give you some peace. So the ultimate list of prednisone side effects, the only side effect is not insomnia, and a lot of people do experience it. That is the number one tweeted side effect of prednisone, but it is certainly not the only side effect. Another person said, I was given no warnings from my rheumatologist. My friend said my bones might be affected. And instead, I have osteopenia, high blood pressure, had to have cataract surgery, weight gain, fatigue, and weakness, and muscle wasting. 7 side effects instead of 1 or 0 from her doctor. That's a ratio that is all too common when it comes to prednisone treatment. Another person said weight gain and messed up sleep. Yes. And those are the two probably most common. They're definitely the two most oftenly tweeted about side effects. So yeah, weight gain and messed up sleep. Another person said pear body, humpback, moon face all came true. So the prednisone causes a weight gain and that fat can go to your face and it makes a round circle like the moon. Then the next person said fat, fuzzy face, mood swings. Should I go on? Which is hilarious because maybe that moon face isn't quite as rocky like our real moon in the sky. It's more fuzzy because you can get male pattern hair growth, like a beard or a mustache. No fun. Another person was told it may cause insomnia for a few nights. Yes. When I discussed my concerns about mood changes and abdominal fat with my transplant team, there was no acknowledgement that prednisone was to blame. That's terrible because mood changes and abdominal fat are 2 of the most common side effects of prednisone. So that doesn't make any sense. Maybe the transplant team is worried about more things than just side effects of drugs. But what's interesting about prednisone is it's such an old drug. They never did rigorous testing and they never found out exactly what all the side effects are. And so the information that is available about prednisone warnings and side effects is actually quite lacking, even though it's been around for so long. So it's possible that your doctor didn't even know, although you would think a transplant team would be experts on prednisone side effects. Another person said, none. I had to do my own research. Next person, if I didn't take Curelin, which is a diabetes therapy, after my 2 meals, I'd be risking steroid-induced diabetes. Yikes. because prednisone is a glucocorticoid. That's the class of drugs that it's a part of. Gluco meaning glucose equals sugar equals blood sugar, diabetes. It's directly affecting our metabolism and our ability to process and use sugar. So your risk for diabetes is 2 times greater than the normal population while taking prednisone. Weight gain, again, another person said, I had no choice. And so, yeah, your doctor is warning you that you have no choice. And that's how it was for me. I had no choice. I either took it or I could possibly bleed to death. I'd rather take it, right? That was the warnings I was given. Another person said, I had a junior doc recommend it and give me rules about the flu and vaccines. And then a consultant was brought in to reinforce that message. Other warnings were, the blood pressure is going up. Hers went down. Weight gain, I was doing okay, but for the lockdown. The flu could make me awfully ill and to report directly to the hospital if I got it. Always have my vaccines, but not the live ones, the chemical ones, and don't miss it. So I have a whole in-depth blog post and video all about prednisone and the flu vaccines, whether or not flu shot or not. Goes through all the scenarios. So check that out if you want to know more about that. I really like what this doctor went through. These are great tips. What a great team there, junior doc and consultant. This one, take it or die. Don't eat sweet things. Don't put on weight and take vitamin D and calcium. Check and check. Those are some awesome common tips. You can either take it or you can die, like in my situation. And then don't eat sweet things because of that glucocorticoid issue. Don't put on weight and take vitamin D, calcium. Perfect. Weight gain, sleep issues, cataracts, osteoporosis, thin skin, and redistribution of fat to certain areas, all of which I've experienced. That's a lot of side effects that a lot of people experience. And those are all really big words, but essentially prednisone is interfering with so many processes in our body, from our metabolism to our weight, to our bones, to our skin, to our sleep, to our eyes with the cataracts. Prednisone is affecting your whole body. These are the side effects I personally experienced. I'm a pharmacist. I wasn't expecting all of these. I knew prednisone was bad, but I didn't know it was this bad. So yeah, I totally understand about this person. Wow, I got them all. Another person was recommended not to take it at night as you won't sleep. Weight gain and being super hungry. And not to take it at night is a great tip for counteracting the insomnia side effect, because if you take it first thing in the morning, that's mimicking your body's natural hormones with cortisol. Bone thinning and possible irritability. Yeah, we can definitely get pretty irritable while on prednisone. Another person said, I received absolutely none as far as this prednisone warnings went. Then I did my own research and found out what I was experiencing was common. Doctors still downplay when I say I get moon face and swell up and retain water. They say it's in my head. I completely understand how that feels, because I knew I had to take it or I could die, right? But the moon face, the swelling, those are real. Those are really visible, impairing side effects that make you feel like a totally different person. And so if you're a person who needs to use your appearance to either get a job or keep a job, having a moon face just isn't compatible. Like, they always publish news articles when a celebrity has to take prednisone, because it's like, why does she suddenly have a big fat round face, right? Selena Gomez, she had to take it. And it's like, why is she like, what happened to her? A celebrity can't look like that. A moon face isn't life-threatening, and so your doctor doesn't really care as far as it doesn't cause other medical issues. It definitely causes psychological, emotional issues, right? Like, having to not recognize your face in the mirror is not fun. Another person said, moon face and weight gain, thinning of bones with long-term use. None. Cataracts when I was 28 was scary, thanks to prednisone. Cataracts are something you're not supposed to get to your great-great-grandma. That's how like old people would go blind, right? Cataracts, when there's something like blocking their vision in their lens of their eye. And that shouldn't be something a 28-year-old would deal with. Prednisone causes it. Ugh. Worst drug to wean from. Doctor never told me about it, but I didn't have any other viable options. Weight gain and moon face both came true, and several other complications such as damage to my tummy lining and lack of sleep. Yeah, it can cause all of those things, including that gut lining. It messes with that. I was told nothing about the side effects of prednisolone. I learned after being on them for asthma for a long time. I so far have developed adrenal insufficiency due to taking them and was borderline diabetic. I have my bones looked at now to check for osteoporosis. They are so far okay. I'm aware they are good for what they treat, but there are many side effects to them. I do like to make other people aware of the things I didn't know about them. If you can, an alternative is better, but if they're needed, such as for an asthma flare. But this can be brought under control in some cases with other medications, so not as many courses of prednisone are needed. And that is fantastic advice when it comes to asthma because there are so many other options that prednisone should really be a drug of last resort. This person said prednisolone, and that happens to be like almost the exact same thing as prednisone, but it's the drug often prescribed in England and other countries. Gained weight and bloated face was true, only had to take it for a short while. So like you can still get moon phase and gain weight even if you only take it for a short while. And relatives didn't even recognize me. Oh, I understand that. All right, another one, none. And I got slammed like a bathroom door. I gained 15 pounds, bloated like a dead cow. Gut health went down. The hair is dry and brittle, and so on and on. Yes, the gut health, yes, it can affect all of those things. And where it's so funny is prednisone is prescribed for gut issues too. For people with Crohn's disease, ulcerative colitis, hepatitis. So it's the prednisone paradox. Prednisone can cause the side effects, and it can be prescribed to treat a condition that is a side effect for other people. Oh, what side effects were you warned about? None. My doctor even said it was my own fault for putting on weight because of overeating. No way. It is not your fault. Prednisone is causing the weight gain. It's best if you can do whatever you can. Here's a warning for you to prevent that weight gain. So yeah, definitely it causes weight gain, but it's not your fault. I'd love to share more about what that is, but not in this video. Weakened bone density, and yes, it came true. Have bounced all around from as high as 50 to 5, which I'm on now. This is the most comprehensive list from a person, and I wanted to have this be like the height of this. From my doctor, this is what she was warned of. Moon face, yes. Weight gain, yes. Osteoporosis, yes. Glaucoma, no. Insomnia, very bad at 60 to 30 milligrams, but better when I got down to 10 milligrams. So did she or did she not get the side effects? Yes, most of them, but the glaucoma, not yet. From her own research, here's the things that she discovered are possible side effects to prednisone and whether or not she got them. Depression, no. Anxiety, no. Facial hair, yes. Hair loss, yes. So that isn't that perverse that it like can cause male pattern growth, like male pattern hair growth and hair loss. Oh, even though she's a woman. Irritability, minimal. Fatigue, yes, when I taper to 20 milligrams. Blotchy skin at 10 milligrams every other day. Headaches at 10 milligrams every other day. High blood pressure, no. High blood sugar, slightly elevated at times. And it feels like I'm forgetting something, which is a side effect of prednisone itself. Feels like I'm forgetting something is brain fog, right? And that on its own, like the full spectrum of dementia, is a possibility when it comes to prednisone. Oh man, that's a great list that she came up with. Finally, I wanted to conclude with the advice of a prednisone warrior. And she said, I have learned you have to be proactive in your own health, as I have. I've been prescribed medications, black boxed against each other, ended up with glaucoma, requiring lasering to both eyes, serotonin syndrome, had genetic testing to find out which medications, which takes into account medical conditions, medications prescribed, and your genetic markers. And based on genetic tests, advises best medications for your body. It's called PGX testing. I have some great resources for PGX testing if you're interested in that. But the most important thing is what she started with. I have learned you have to be proactive in your own health. And I completely agree with that. That's why I created the prednisone checklist. And you can download it at the link below. It talks about my side effects and ways to prevent them, plus the top 7 warnings that you need to know about prednisone. I promised at the beginning that I would share with you some ways to find out about prednisone warnings better. So there's that prednisone checklist that has the top 7 warnings people wish they'd known. Then there's some things you can do that will get you the warnings you need. So first of all, you know that annoying question they always ask you at the pharmacy? Do you have any questions for the pharmacist when you pick up your medication? Well, they don't do that just for the fun of it. They're actually required by federal law to offer you to find out about your drug. It's called, they're required to counsel about your medication. You are entitled to this benefit by the federal government. It's your opportunity to find out everything you need to know about the medication. So take them up on it. Ask, what warnings do you have about this drug? What drug interactions should I be aware of? What supplements shouldn't I take with this drug? Ask any questions you have, because that's actually the pharmacist's favorite part, is talking, sharing the facts we've learned from 6 or more years of doctoral level training. It's fun to actually share our knowledge instead of just lick sticking and pouring the pills. Ask your pharmacist, what should I know about this drug? And they would love to share it with you. So talk to your pharmacist and download the Prednisone checklist. Click the link below. Signing off as Dr. Megan, your prednisone pharmacist.